Hi everyone, and welcome to another edition of Face the Case by PRS Global Open. Today, we're presenting a case of a 4-year-old woman who presented to a private practice with persistent lower eyelid swelling, surface irregularities, and firmness. These symptoms began several weeks after she received calcium hydroxyapatite injection to correct the infraorbital hollowness and tear throat deformity, approximately 1 year earlier. Despite undergoing intralesional corticosteroid injection, the swelling and nodularities remain unresolved. On physical examination, non-pitting edema, palpable induration, and irregular lower eyelid contours were observed, with no signs of active infection. So, the problem list we have: history of calcium hydroxyapatite injection used in the tear throat deformity, persistent edema, and lower lid irregularities and induration, suspect delay inflammatory response or granulomatous reactions, and poor response to conservative management. How will you face the case? Option 1. Systemic corticosteroid combined with direct injection of 5-FU. Option B. Surgical excision of the fibrotic tissue. The votes are in and you choose option B, surgical excision of fibrotic tissue.
This is Dr. Aref Nassar from Hôtel Dieu de France, Beirut, Lebanon, and I am honored to take part in this PRS Global Open Face the Case challenge. The correct answer in this case is surgical excision. So the patient presented to the clinic with lower eyelid edema and irregularities following calcium hydroxyapatite injection, which were unresponsive to conservative management, including multiple corticosteroids injections. So by the time she came to the clinic, the nodules were firm and fibrotic and clearly visible and distressing to the patient. The clinical exam showed also signs of induration and contour deformity, so surgical excision of this fibrotic tissue was necessary. Intraoperatively, we found dense fibrosis with no clear separation between the orbicularis oculi muscle and the fibrotic tissue, so we performed a conservative excision to preserve the muscle and reduce the risk of ectropion. And the eyelid skin was also thickened, so we thinned it and defatted it to restore a more natural contour. And finally, we performed an orbicularis suspension to maintain the lower eyelid position. At the 3 months follow-up, the patient showed clear signs of aesthetic improvement and a smoother contour and improved skin texture. There was mild residual ectropion, which may require a cantoplasty later on, and fat grafting is also necessary for final refinements. So in conclusion, this case highlights the risk of using calcium hydroxyapatite in the lower eyelid area, and once complications like fibrosis occur, surgery becomes necessary, especially when conservative treatments have failed. Thank you for watching, and for more fascinating case reports, please visit prsglobalopen.com, and we'll see you next time on the PRS Global Open Face the Case.